Hey everyone, it's Eric Glazer and welcome to Bright Spots in Healthcare. Today we're exploring how Oscar Health and Hy-Vee Health are partnering to create a new innovative health plan, making it more accessible, more local, and very, I'm going to call it human-centric.
Amen.
All right. So today to share this story about collaboration and innovation, and this is a great, cool collaboration or marriage you guys have here, is DeStefano, head of growth at Oscar Health in New York, and then Dr. John Van de Veer, founder and CEO at Hy-Vee Health in Iowa.
Correct.
I love that. So tell me a little bit about what you guys are creating here. How is this different from a traditional health plan that we're so familiar with?
Lewis, take it away and I'll fill in.
So we've actually been in Iowa for several years, and this partnership came about probably, just a little over a year ago. And we're trying to solve the problem of the small employer and middle market access to care. And healthcare is local, and I think a majority of this country is overinsured or provided the plans without really having much say. That's not really how we purchase anything else in this country. An example I had is everybody probably flew into Vegas this week and picked their airline, picked their seat, and we didn't really think twice about that. That's a choice that we have. But in healthcare, you don't really get to choose who your doctor is or the plan or the level of your deductible. And this unique product is actually going to be really local with two great brands, and gives us the ability to actually get all of your coverage in a very trusted local brand, while still having the technology and experience that Oscar brings from a health plan.
And then from the Hy-Vee Health exemplar care side, we're at baseline a direct primary care clinic that really is patient-centered. Everything we do is how do we make care easier? How do we make it faster, more convenient, easier? And we partnered with Hy-Vee about 2 years ago, and they're 50% owners in our partnership. And they're obviously a retail grocery store. And how do you make things simple? How do you make getting care easy? How do you make it so that there is no additional cost? People walk in, and on the employer side, an employee shows up and they don't pay anything. They don't have a copay. They don't pay anything on towards the deductible. Meds, labs, imaging are dispensed or taken care of at no additional cost. So, and then you have Oscar's health product on the backside, supporting other things moving forward. But there's basically no abrasion, and it's really easy to get highly personalized care. And because it's not fee for service, we're not in a rush. I don't have to see 25 people. I can see 12 people and I can spend 35 minutes with them and actually get to know them, take care of them. And people just choose it once they get to experience it.
Okay, so I want to break this down. So it's really, and I set it up as a collaboration between two, but it's really a collaboration between a supermarket chain, a primary care clinic, and a health plan that's a tech-enabled health plan.
Correct, baked into one product.
That's
so
right.
From a member experience perspective, they'll see Hy-Vee and Oscar, but they're choosing one health plan.
That's right.
And that integrated experience is the key.
Great. And tell me a little bit. So break it down for me. When as you were talking, John, I'm sort of thinking of a PCMH-ish kind of experience. And so break it down. If you could compare what you guys are building here and compare and contrast maybe some of the models we're more familiar with that are working and some that aren't, to really kind of unpack why this is a little bit different. I'll come to you two.
Yeah. So from a traditional direct primary care model, it's a membership fee. So I always say it's concierge light. So, and in this case, it's built into the premium. So there's no additional membership fee here. Again, back to it being seamless. So you choose to come see us, you're built in, and then you come and get care. We have a net promoter score of 85 plus. People love it. They have access to a 24-hour urgent care built in as well. For data, we had Hy-Vee employees that use us in the Des Moines Metro had 250 visits between 7 p.m. and 7 a.m. And from a cost perspective for an employer, those are people who aren't going to the ER. They're not they're not missing work in the morning to go to the doctor. And from a health plan, those are lower cost visits. And in this case, because they're built in, they don't cost the plan anything more either.
And is there a digital component to this too?
Of course, and that's really where we come in as well. Is like we have obviously a digital AI component that we just rolled out called Oswell that's clinical driven and has member records that a member can use and can obviously help them with prescriptions and after hours and then actually drive them right to Hy-Vee Health and Exemplar Care. But just backing up a second, I think the fact that the fees and this concierge program is built into a health plan is the unique component, that you actually take the dollars that your employee or employer gives you via ICHRA, and we can spend some time there to choose the plan that best fits to you. And I think when you actually look at the economics and the convenience of Hy-Vee Health, I'm a family of 3 young children. It makes a lot of sense for you to get care in one place that you're local and comfortable with at no cost share. And that's really where your premium dollars from your employer can go a lot further.
Yeah, I love it. So we're getting local, we're putting up buildings, we're incorporating technology. We're going to double click on Oswald in a second. And we've got sort of a little bit of some of the SDOH covered with the integration, not only local, but with the food chain tied to it.
Yep.
I love how this sounds. Tell me, is this going to be, it sounds like you're selling this. Are you selling this through the employers or are you going direct to consumer on it through the ICHRA? Like what's the commercial model?
So it's an employer-based product. So to have an ICHRA, you do need to have an employer give contributions, which is a healthcare premium stipend that must be used on an individual ACA product. So the Hy-Vee Health product is one of the products in the portfolio. And I think the beauty of it, and 2 examples I'll give is, not everyone has to choose it. I mean, we believe a majority of folks should. I think it's the best product if you live in those respective counties. But if you like another carrier or 2 other carriers, you can split it. If you're actually a family, your spouse and children can choose a different plan. And that's some of the uniqueness in individual buying that doesn't exist in the group and the traditional employer space. And another plan we're rolling out is Hello Meno. It's a menopause plan for women 45 and over that's going to like lower cost shares for many of the procedures they have. And we've been told already that the mother's going on one plan and the spouse and the children are going somewhere else. And that unique buying power with the Hy-Vee products really makes this exciting.
And adding part of the Hy-Vee component into it. So there are healthy rewards that Oscar always does. And in this case, if they fill out or if they have their physical, they do their biometric screenings and a couple other things, then they actually have access to a gift card and other options they can choose from. And they can go in and they can buy their fruit, their vegetables. They can use those dollars directly in Hy-Vee. And again, if you're in the Des Moines metro and you're picking this product, you're shopping at Hy-Vee most likely. It's in the title of the silver, gold, and bronze plan. So you're kind of tying all these things together. And it's back to what you said about getting to Las Vegas. Everyone made a choice. And in this case, they know exactly what it costs. And in this, from the clinical side, they know it doesn't cost them anything additional until we send them somewhere else. And then they have their traditional copays and deductibles. So,
and is that where is the pharmacy going to exist within the Hy-Vee stores, or there are other pharmacies involved in this?
There's multiple involved. So they do have, they're going to have access to all the Hy-Vee pharmacies. And again, most of those folks are probably using that. But from a dispensing standpoint, Exemplar Care actually dispenses 30 or 40 medications directly in the clinic. So you come in at 2 a.m. with your kid who's got an earache and they need an antibiotic. We fill it right there. You go home, you go back to bed, you all go to work in the morning, your kid goes to daycare.
Okay. And so are those clinics 24/7 or?
We have both the direct primary care clinic attached to a 24-hour urgent care that also does virtual care on top of that. So we basically give you access. Do you want to text somebody? Do you want to go through a portal? Do you want to be seen face to face? If everyone else is closed, all right, I'm going to go to an urgent care that is associated with my provider instead of going to an emergency room and waiting for 8 hours.
And then Oscar connects your network of providers in the market, your specialists and the hospitals involved. Correct. And all of a sudden we've got the primary care clinic, we got the primary care connected urgent care to keep my costs down when I'm after hours on a weekend. And then I got a great coordination of care there because I'm sure all my information is. And then I've got local hospitals that Oscar's connecting and my specialists.
Correct. And both of us have basically care coordination capabilities, and we all know exactly where that Hy-Vee Health with Oscar patient is supposed to go.
Yeah, we're investing a ton in that experience and coordination because this is year one. We have big aspirations for this to be a much larger partnership.
Okay, so Louis, I have to ask you just real fast because I really like the sound of this. I have a lot of this is a cool model. Is it Oscar's vision are you guys in some ways putting some of the chips into the middle on ICHRA? And are you going to, if this works in this market, what's next? South Dakota, Arizona, like what's the...
Yeah, we haven't been shy about it. We believe the individual marketplace is the healthcare marketplace of the future. For all the things that we just discussed about, whether it's the Hy-Vee, buying a premier direct primary care product, or whether it's buying a diabetes plan, or just a traditional ACA plan that fits you in your local market. I mean, I think that beauty of being able to select what you need, again, based with your employer contribution. So this is still employer-sponsored coverage as we know it today,
Right.
But now you actually have a healthcare wallet of what you want to spend. If your wife is pregnant and you want to hire a doula, you can do that. If you want to buy an Oura ring because you're young and healthy and you want to spend your extra dollars there, you have so much freedom on what you can and want to buy within this health reimbursement arrangement. And that's one of the exciting things.
And two really cool things with this. One, it's a defined contribution from the employer space, and we're in the level funded, self-funded space as well. And we're watching people who are just starting to price out, and they're considering getting rid of benefits. And we're like, no, there's an option where you set what your company can actually afford to pay towards healthcare, and then you let your individual employees go be a consumer and pick out what's best for them. And I think Oscar CEO Mark Bertolini, when we first met, said, traditional employer health-based plans are, here's the 3 mediocre averages, pick which one is closest to you. There's 1,000 employees and you get 3 choices. You should have 70 choices for that many people. And the ICHRA space allows you to actually do that, where the employer is just an enablement to you going out and picking what you want as an individual.
Okay. Before I would love to stay on the strategy kind of ICHRA topic, but I think we hit it enough. I want to come back to the integration of this really well thought out sort of bricks and mortar partnership, and now talk about the tech and the AI. And, Lewis, you brought up Oswell. So let's talk about how you're integrating some of your cool tech into this very grassroots kind of foundation that you're creating here.
Yeah, so we've always been, as you know, with your history with Oscar, a member first technology company, and Oswell is a partnership with OpenAI. It's a chat agent that will be built into. So you have the ability of the member to actually provide their medical records, but it also has integration into the health plan medical records. So whether the member takes the action or they actually have claims on file that can be used in their actual questioning, and then it's going to drive directly into the exemplar clinics to when you need to go to brick and mortar. So, I mean, I do a lot of work on ChatGPT with my own blood results and whatnot. This is kind of almost enhancing it with actually into your health plan. So I think that's the key component. Your health plan can see the prescriptions you have, or do you have a 90-day supply, or when is your next visit needed for your child? It's real integration into your claims experience, and then obviously on the provider side for you guys.
Oh, and that AI empowerment from the provider standpoint, I know I've talked to a lot of colleagues who are terrified of it. Like, where does this fit in? I love it. I had a lady who came in the other day and she said, I have sweaty feet, but when I touch them, they're not sweaty. And she said it's been going on for months. And I was like, I have no idea what's wrong with you. I'm board certified. I'm smart. I think I know what I'm doing.
And you're an internist by training?
Correct. And I went through, pulled up ChatGPT 5.0, I think, and said, you're a world-renowned dermatologist, went through all the symptoms. And I said, she sat and watched me do this. I said, all right, here are all the things, and this is where my expertise comes in. None of them are of a concern. They're all benign.
So it's like it's almost up to date, next level up to date.
It's way beyond anything up to date can dream of.
Yeah.
I sat at a table with a board certified family medicine, me, and internal medicine, and a pediatrician. And the 4th person at the table was a CEO of a state health plan. He pulled up his app and did his thing, and he actually came up with the diagnosis that the 3 board certified physicians couldn't come with. And he said, what about this? We're like, oh yeah, that's what it was. I mean, it was so profound. Yeah. So if you're running from those types of technologies, patient care is going to suffer. I mean, these are amazing tools. It's going to be the new stethoscope.
Guys, so let me just, I want to try to illustrate the experience you're trying to convey and see if I've got it. And I was recently in the ER with my wife, and what I thought was profound, and she ended up getting admitted, was I was getting the lab results from my chart before the provider was coming in to even see us and talk about it. Now, of course, I'm sending them to friends and the PDS. So is Oswald, so if I'm sitting, let's say, in a room in the ER, I'm not in the waiting room anymore, and we did some blood work. The blood work comes into my chart, wherever else that hospital in Iowa is using. Is Oswell telling me a little bit about what those results mean before my doctor comes in?
We still want to have the patient member relationship. So I think it could good to get some information beforehand. I don't
totally. I'm wondering.
And I do that. Right? I get my Quest results for the past 4 years and all the modifications I've had and where I should change my diet. But yeah, Oswell would be could be real time, but I think it's also for the fact of like ongoing maintenance. If you forget something, like not everyone's going to remember what their medication or their how they're supposed to be living their lifestyle. So I mean, we're all in healthcare. We're thinking about it every day. I don't know if you have any other thoughts, Dr. Down there.
I think that's where it's really facilitating getting the information and knowledge there, versus an instantaneous solution for the patient to make their own diagnosis. I would say you need that professional touch back to say, okay, you're on the right track. Don't discourage it, but make sure there's still a human component in there, because that's what patients are really craving. I mean, we joke, okay, our NPS score is really high, but every comment we get is, I've been to 6 providers. This is the first time I felt heard. And that's what people are really craving, is that actual relationship again.
Okay. I know we're running out of time. I want to cover next where we are in this story. So where are we at? How do we know it's going to be successful? I want to quickly touch upon, and this is going to be hard for you, but I want to go there, the provider experience, because I think that's super important. And then I have one final question, big picture question about the future. So let's start with where are we at in this story and this collaboration right now?
This is the tip of the iceberg. This is the 1-1 will be the starting point for this. The leads being generated already from the smaller businesses has been pretty profound. The interest, everyone we talk to loves the way this sounds. And then to get to your next question of the provider experience.
Before we go provider,
yep.
Let's say we're sitting back here in a year. Hopefully we're all hanging out in a year from here, same table. How many members? What's the health plan look like?
We have a goal. I don't know if we want to share it here, but I think we have a penetration goal that we want. I mean, I think some of the success will be on, can we get a few large employers to do this? Can we get small employers who never offered insurance to come into the game and say, hey, now I can give you a stipend and you can go buy a Hy-Vee plan and get free health care.
Is that how it's being branded, Hy-Vee?
Hy-Vee Health,
Hy-Vee Health
with Oscar.
Okay.
As the logo.
Oh, there it is. There it is. He's got a shirt on.
That's why I wore it today.
And is it going to be on the exchange or no?
It's an off-exchange product.
Okay.
And we are looking, that's one of the things that will almost certainly, if there's CMS regulations, we don't need to waste time there, that would allow this to be an on-exchange product, because you could see a subsidized member also saying, hey, I don't mind paying the extra differential in premium because I'm going to save it in cost shares for my family.
Yeah.
So I think those are some of the things, and I think we have aspirations to go into many more markets.
Oh, yeah. And I think we're going to go into a bunch together. I think they're going to find new partners to do similar things.
Yeah.
But I could see this in 8 to 10 markets in a year, getting ready for 2027. So I think
we're
this
open
is
for
going to
business.
grow.
We have the ability to scale this for 27 and 28, particularly for individual off-exchange products. So we've done it with Hy-Vee. We've done really customized plan designs. We are open and looking for partnerships to bring unique products to the individual marketplace of the future.
Provider experience.
So being in direct primary care saved my medical career. The churn and burn of fee-for-service was, I met every clinical definition of burnout. You go from seeing 25, 30 people a day to now you text with 10, you have 2 phone calls, you have 5 face-to-face visits. You get to build those relationships again. You don't have to worry about hundreds of pages of documentation. The data is all readily available. The ambient AI has been added in. I think the experience from the provider, physician, clinician side is what's missing now.
So and what's going to be the makeup of these clinics, MDs, NPs, PAs?
All of the above.
All of the above.
Yep.
And the direct primary care model, everyone's going to be on salary with some probably bonuses tied in.
Yep. I mean, you look at some of the most successful health systems and not having misaligned incentives to do more, see more. I mean,
right.
We really are, our metric is the quality metrics and then the patient experience metrics. And that's really what we're chasing after. And we're not looking at them from a punitive point either. It's just you should be able to practice the way you want to and spend time with people, and everyone should enjoy it.
Could this be with the onslaught of all the technology we now have at our fingertips, the tipping point for direct primary care where we can make the business model work and make it scale? Is that what Oscar's thinking?
I mean, I truly believe that building it into the premium and into the ICHRA reimbursement takes away that potential friction of, wait, I need to go pay an additional fee for my healthcare?
Okay, so you're saying maybe it's the combination of the ICHRA model combined with AI and then taking this direct primary care model that's been around for a while, but still hasn't like taken off like it should have had, in my opinion. And then we combine the three and maybe we've got something here.
Into the health
Correct.
plan. Yeah.
And I think if you look at the historic 1 and 2 person DPC practices, they were kind of that libertarian flair. I don't want to screw with anybody. I don't want to deal with insurance companies. I left because I wanted the care piece back, and I want to be able to deliver my product built into a product that will take care of them when they aren't inside my walls. When they have a heart attack or they get cancer, I don't want to have to figure out, okay, well, now we got to get you on Medicaid because you didn't qualify for anything. Like, how do we get people the right product from day one and they love it and they stick with it? It's a lot easier.
One last question for people who are thinking about building this potentially a similar model. Do you have an inherent advantage starting in Iowa? Is there a compensation issue where you guys could put these highly talented, highly trained providers on salary at a level where in New York City, it may be harder to pull this off? Or do you think it works regardless?
I think healthcare is local. I think it's going to be county by county decisions. Yeah. I think it can work in major metros. I think Hy-Vee's got a great footprint in the Midwest, and that just happens.
Yeah, I mean, we have clinics already in Kansas City, Omaha, and about and Sioux Falls, and 7 or 8 other places in Iowa. And I think every one of those markets has a really unique opportunity with products like this.
It's awesome. All right. So could we talk about in 10 years, what does this look like in 10 years? Is that too hard?
I mean,
no, that's the fun stuff.
Yeah. I mean, it's, I truly believe in this, and our CEO, Mark Bertolini, said it, that, the employer sponsored coverage shouldn't exist. Now, I believe employer sponsored coverage to the individual marketplace should exist.
Yeah.
I think we're going to see tens of millions of Americans purchasing healthcare on an individualized basis. Now, there'll probably be other reforms and government regulations that modify that over a decade, but I certainly believe more dollars will be going to Americans for them to decide how they spend it on their health.
Lewis, I was recently talking to someone who said the individual marketplace is the marketplace of the future.
It absolutely is.
All right. So tell me, last question, and we'll get you guys out of here. Second to last question. What's a smart organization or individual that you guys have either met with, read about, looked to within healthcare, or even better outside of healthcare, that's kind of helped inspire both your individual roles and how it's kind of influencing your thinking as forging this innovative partnership? Everyone stands on the shoulders of giants.
Yeah. It's a challenging one.
There's so many people. I mean, I actually had a cool experience about 2 months ago. I met Garrison Bliss, who founded what was deemed probably the first direct primary care clinic ever. And he basically said, from a clinician standpoint, you should have a healthcare model where you're taking care of people and you have no perverse incentive. Like, if I need to order blood on you, I shouldn't be doing it because I'm going to get paid for it. I should be doing it because you need this test. There's a reason for it. And I'm doing right by you as a consumer. And I think it was really profound to hear someone say, like, healthcare needs to get back to where the trust was built, which is I'm taking care of you and doing what's right for you, not how can I maximize my billing and optimize my income.
So Garrison Bliss is the godfather of direct primary care.
Correct.
All right. I'll take you off the hook. I think John saved you.
Yeah.
So, all right. Where do people find more information about this partnership? Where can we follow you?
Yeah, HiOscar.com. You can check out our direct website.
Can you spell that so people know?
HiOscar.com.
Okay.
HiOscar.com.
And there is a /Hy-Vee version if you want to get to this specific product.
So spell that out.
HiOscar.com/HYVEE.
Great. Guys, thanks so much. Thanks everyone for listening. We produced this show for you, and hopefully you took a lot of the great ideas that were just shared and applied that to your thinking and your organization. just a reminder to everyone, this is your Bright Spots in Healthcare podcast.